stage fitted. You can always keep the first stage fitting as a gold standard. Okay, all the aligners, rest of the aligners should fit like how it fitted in the first stage. If there's any problem when it's compared to the first stage, then definitely you need to go back to the previous stage, where for few more days before progressing. Otherwise, I've heard many patients telling, doctor, it was not fitting properly, but what I did is I chewed it and got it fitted. So how would it have got fitted? The aligners would have got distorted, and then that is how it got fitted. So distorted, if the patient wears a distorted aligner, means definitely that will lead to inadvertent tooth movement. So that shouldn't be the case. So that is why you need to make the patients understand. So you need not call the patients every month, but at least once in 2 months or 3 months, it's mandatory to call the patients and see how it is progressing. So that there will be an accountability also. Patients also would know, okay, if I wear it properly, only things are going to progress, because I need to go to the doctor next month, so I need to get it fitted properly. So that is why the patient shouldn't discard a particular set of aligner once it is over. Because if at all, a patient misses an aligner, or if at all a new set is not fitting properly, they need to troubleshoot it, track it back. So tracking it back means go back to the last fitting aligner and then start from there. Okay. So these points you need to keep in mind, and you need to make sure that the patient is also aware, especially patients who are not in town. So any doubts in this point?
Do you have any online follow-up system?
Online follow-up system, we are developing it. So in the near future, we will have it. So next is again another common thing what you have to look out for. So what do you think is the problem with this? Like, are you able to make out any problem with this? This is one scan which came to us after aligner treatment. Are you able to see a lateral open bite? So why has it occurred? Here what has happened is, the third molar supraerupted. So initially when the doctor gave the scan was only till 7. So we extended the aligners till 7. And if you extend the aligners till 7, means I told you 0.8 mm thickness is there. So 0.8 and 0.8 means 1.6 mm gap will be there in the 8, and the 8s have supraerupted. So that is what has happened here. So when you see that a third molar is fully erupted, make sure you involve that third molar. Whether you take an impression or a scan, make sure if there's any kind of accessibility issue, make sure that you at least get till the half, at least till the first cusp, so that we can extend till that, then that will prevent the supraeruption. Okay, so that is also very important.
This really bothers settling of occlusion. See, any DMJ problem happens because we treat by giving something between the teeth. This itself is a process where we have something between the teeth.
Yes.
The occlusion settlement after the treatment is how do I get it properly?
That happened. So I am Invisalign certified. So I myself went to a course for that. So I asked the same question. So what they were telling is, especially in an extensive treatment, which is beyond 9 months to 10 months, this can happen. So just make sure that if it is a through and through open bite, like little bit of, not a huge amount. Now we are planning according to that also, so that we don't get it quite often right now, because we give an inadvertent extrusive force a little bit per tray, so that will prevent that. But if at all this situation comes, we need to see if it is through and through. So if it is through and through, means it will settle. Give a lower thickness retainer, like 0.8 or 1 mm. So that will settle with 2 months or 3 months. That will settle on its own. But if the open bite is caused due to any lingually tilted cusp, or if it is any lingual rolling that has happened, then you have to take that into consideration. You have to give refinements and fix it. Then only it will happen. It will get settled.
How long does it take after the finish of the Invisalign to ascertain that this is settled?
Around 3 months, 2 to 3 months it will take. And the best way how you can go about it, if you are giving a retainer with the occlusal surface, free occlusal surface, that will settle faster. That also you can do. So a little bit more I'm taking. So earlier Dentcare aligners means we had only one variant. Okay, so in the recent past we have come out with 3 variants. One is Dentcare aligners upgraded, then premium, and a new aligners. So new aligners is an economic brand. So I'll just discuss fast about these variants. So Dentcare aligners premium means a triple layered material. I told you, triple layered. Now multi-layered materials are better. That is giving better result and also with minimal discomfort. Because since it's a triple layered material, the flexibility is very high. So here Zendura FLX material is used, and if you see here, it's a triple layer. Outer and inner layer is made of PETG, and the middle layer, what you can see in this aqua blue, that is made of TPU, thermoplastic polyurethane. So that is ideal in cases where there's crowding cases, lower anterior crowding and all. What I've noticed is patients feel a bit of discomfort. They tell that there's a immense tightness in the initial stages. So here there's a 40% lesser insertion force. So that is why